All right. Well, everyone, welcome again. My name is Angelia. I am the program coordinator at the Student Health and Wellness Center here at CDU. Also with me in the audience is Sarah Santana, our our director here at Shaw and one of our therapists. And then we also have Doretha, who is our student worker. Now, as we all know, February is Black History Month, which is a time for us to celebrate and remember all of the contributions that the Black community have made and continuously make here in the United States. Black History Month reminds us to collaborate on ways to improve each other's lives, to have conversations about hope and advocacy and accountability. It's a time for us to gather and build on the strengths that already exist within our community, and just to celebrate Black joy and Black excellence as well. Here at Shaw at the Student Health and Wellness Center, we provide services and resources to students that promote a safe space to discuss and advocate for student health, mental health. And as a way to celebrate Black History Month and to bring awareness to mental health strategies, Shaw has invited 4 incredible speakers to discuss our topic for this year's panel, which is embracing sacred spaces within the Black community, reimagining self-care, and building on strengths. Shaw felt it was important to present this panel as we are in a time where systems are continually trying to diminish the lives and the stories and the voices of BIPOC, queer, and immigrant communities. So today we have with us individuals who work to uplift those voices in LA and beyond LA, as well as advocate for better mental health outcomes within these communities. So with that being said, I would like to introduce our panelists for today. First, we have our very own Dr. Barrett, who is CDU's Director of Health and Wellness for the College of Medicine. One fun fact about Dr. Barrett is that she likes to travel. So Dr. Barrett, I will be inviting myself to your next trip, regardless of where it is. Thank you. The next presenter we have is David Lee, who is the clinic director at APLA Health Center here at the CDU MLK Medical Campus. David is also a seasoned traveler and actually lived in Lima, Peru for a couple years doing HIV research and training. Our next panelist is Sean Jordan, a nurse midwife at Claris Health. A couple fun facts about Sean is that she's an avid roller skater and a soul line dancer. I'm very tempted to ask you to do a dance move for us, but I won't put you on the spot like that. So, and lastly, we have Successful Brim, who is the CEO and founder of Minority Psychology Network and a doctoral candidate as well. And I don't know how she does all of it, but Successful is also a radio personality for 93.5 K-Day on the Romeo Morning Show. Wow. I don't know, I love it. But we obviously have some incredible panelists for you all today. So we'll get started with our questions, but real quick, panelists, again, if you feel led to answer a certain question, please go ahead and do that just by unmuting yourselves when you're ready to answer. When it seems like we are done with our responses, I will go ahead and move on to the next question. And for those of you tuning in today, if you have any questions throughout the panel, please feel free to add them into the chat, or you can wait until the end of the discussion where we will have some time to answer some questions. So sound good, everybody? Awesome, great. So our first question for today: what drew you to work in the mental health field, which is a space that historically and sometimes even currently hasn't been accommodating to people of color? How do you build a space for yourself in this field as a provider? Dr. Barrett, would you like to get us started with this one?
Sure. So I got into the mental health field. I got interested in it since high school. I was um, taking psychology courses and thought this was the way I wanted to go. But I got interested more so after I was in the AmeriCorps for a couple years and was a part of this diversion program in upstate New York. And I remember hearing this white psychotherapist talk about a group of people and was just saying just disgusting racist stereotypes. And it just dawned on me like these are the individuals like who go and see someone like that, and I just knew that there needed to be more people of color. I know that I'm just one person, but at least an option, one more option for people who look like me, especially in a community that looked like me. I was just like, I don't know. I think also at that moment, it was like, oh, just because you have certain letters behind your name doesn't mean that you can't have these prejudices and biases and be racist. So I just wanted to kind of be a part of the cause, knowing that less than 2% of individuals of color are psychologists, and I needed to be a part of the percentage. Yeah.
You saw the gap and you filled it.
Trying to. I'm
Trying
just
to.
one person. I think there's
Yes.
still quite a gap, but
Yes.
trying
Yes.
to. Yeah.
Exactly. Thank you so much. Any other panelists that would like to share?
Yeah, I'll go. So, again, hi everybody. So happy to be here. But I decided to create my nonprofit, which is the Minority Psychology Network, in order to have more individuals that look like us, in order to gain an understanding that, we can, be people of color and give psychoeducation. We can all make sure that we speak to somebody that looks like us. I learned, while I was in college at Howard, I was like, this is some information that I should have known in grade school, so I wanted to make sure that we got a network of individuals who were mental health professionals and advocates who could spread psychoeducation to those who are willing to understand and get the help that they need.
Absolutely. Again, another wonderful example of finding the gap and finding the need and being able to fill that to the best of your ability. And even in the form of just creating your own nonprofit. So that's wonderful. Sean, would you like to share? Or David, sorry, since you unmuted.
I would I got into the field when I was living and working in Seattle, and most of my career has been in the field of HIV. And I quickly realized, I don't know if most of you know much about Seattle. It is about 5% African American, about 4% Latino, about 26% Asian Pacific Islander, and the rest are mostly white. So I quickly recognized that, there weren't that many people of color in the field, in the mental health field. And um, while working in Seattle, decided, okay, I can help fill that gap. Like I hear other people have already talking about, you saw a need, there was a gap in care, and I decided to start my own private practice at that time, um, because I felt like um, people need options. They need the opportunity to have a provider that has a similar racial ethnic background as they, whether it be also by gender or sexual orientation, or people really need to have those options. And that's what drew me to the field.
Wonderful. Thank you so much. And Sean.
Hi, everyone. Thank you for having me. I, I'm from a little bit different background, as I am a nurse midwife, women's health care provider. So I'm indirectly in the mental health field in the way of partnering with my patients, as well as, as a primary care, seen as a primary care provider, as an OB/GYN provider. Oftentimes, I may be the only provider that, our patient may have contact with. And I fully understand that I have an approach with my patients that is multidimensional, understanding that that it's about someone's mind, body, and spirit that needs to be addressed. It's not just about their pregnancy or their health care, but that their mental health is so important. And so that's why I'm so passionate about this field. Also, of course, with perinatal medicine, perinatal and postpartum psychosis and postpartum depression is such a crisis right now, and a lot more information is coming to the forefront and about that, and encouraging women during their pregnancy and beyond to address any mental health issues that they have. And for me to be able to make referrals and resources to our counseling department and other agencies in the community to assist. So that's the part that I play in mental health.
Thank you so much. And I think David and Sean bring up such important buckets that exist with, being just outside of Black is, sexual orientation, gender orientation, health status. If a person is pregnant, things that go beyond our existence that are all very important to address. So thank you all for sharing those experiences as a provider in the mental health and the healthcare field. And I'm sure so many of us can resonate with what you've shared about being in these spaces where we really don't sometimes feel like we belong, or that were even created for us in the first place. So again, thank you. So for our next question, communities of color often face with collective trauma and can sometimes struggle to find spaces, safe spaces to gather and care for one another. What suggestions do you have for students who may struggle with finding a sense of community, belonging, and mutual empathy?
I would say, find a network, find people with similar interests. And in the case of students, that might be other students or student organizations on campus, and finding, a trusted ear of someone to talk to. That's been most of my career, is just finding, uh, groups of people who have similar interests as I, um, and being able to talk to people, people I trust. Um, and so I would just say, build a network. I know that may sound simple to some, but more complicated to others because of, challenges like, the obligations of class and studying, and maybe even work on top of that, and maybe caring for family. Um, the internet adds another dimension that gives us more opportunities to connect with people. But I would just say, really, um, find your people, whatever that looks like, whether that's, by race or gender or other demographic information, and build a community, um, and yeah, that's what I've done for myself, and I've seen it successful with other individuals and students as well.
Yeah, I think I really enjoyed that you mentioned the internet too. I think it can be a lot of people's worst enemy, but it can also be our best friend in being able to find those communities, maybe a little more niche. Like if you're a student that is, has a whole family to worry about, and you maybe can't really connect with your peers as much on that. And then I also would like to plug our center here at Student Health and Wellness. We always have a safe space for our students here as well. But Successful, would you like to share on this one?
Yes, definitely. So I would say find a peer support program. You can Google that, find that in your area, and also One of the programs that we partner with is called Jail Guitar Doors. So what we do is every Friday we host a drum circle where essentially we showcase how music could be therapy. You know, if you're into the arts, things like that, we do like a drum circle. We go around, discuss how you feel. And then after that, we do one-on-one therapy sessions. And if you want to perform, you're an artist of any type, you know, you can do that. And that is, you know, healing, you know, music or whatever type of art that you're into. So you can just go on our website, the Minority Psychology Network.org, or go to our Instagram, MPN underscore, no, minority underscore psychology underscore network. And then you can find out the information about that. But I do understand it's not easy trying to find, you know, programs when you are, you know, trying to find somebody that you can speak to or feel comfortable with or your age group. So it definitely is a task to, you know, look for somebody or a group that can actually help with healing. So yeah, please check us out.
I think I'll even check it out myself too. And
Yeah.
whether you're a panelist or just listening in today, if there's any organizations or resources, this is an open discussion where we can all learn and grow. So please feel free to share in the chat. So we appreciate that. Sean or Dr. Barrett, would you like to give this question a try?
Well,
Um,
oh, you were
go
both
ahead.
smart.
No,
Go
go ahead.
ahead,
Go ahead.
Dr. Barrett, go ahead.
I wasn't going to add anything else. I think David and Successful kind of
Right, right. I
gave
was
the same things that I was going to say. Yeah.
Yeah, I agree. Yeah, with David and Successful Brim both talking about building networking circles. Also, you know, some of the other resources could be church groups. It could be besides the peer support groups, mentorship programs. You know, finding, as John said, those with and Successfuls both mentioned finding your group or your people with common interests and common goals can build that, foster those relationships for networking and creating that safe space where they're able to receive guidance even from professionals. Say the student is majoring in neuroscience, you know, they may find a mentorship group that has professionals that are neuroscientists that may be their niche, and from that can foster communication and a support group where they can have these questions aside from their academia and their career, but they can sometimes tap into this commonality of challenges or, you know, abilities to connect one with another. So looking at all those different things online and in the community and in the church, and also in those professional mentorship programs or other spaces.
And thank you so much for kind of highlighting finding that common interest, because it's a very scary first step to be able to reach out to your community and even just trying to find that and establish that in the first place. So I think just finding that common interest can really just help ease a lot of nerves that may come up during the process. So thank you all for sharing that. So our next question: how has your view of mental health care and self-care changed or evolved over time? Have any of you seen new trends in self-care? And do you encourage anybody to participate in those self-care techniques?
I'll start. I think for me with mental health, just seeing how it's not only about mental health, how other aspects of well-being can have an impact on mental health. So if you're not taking care of yourself physically, or your finances are not where they're supposed to be, and you're struggling, and how that can have an impact on your mental health. So I think having a holistic approach is important when we're looking at mental health, because all those things, like how stress, lack of sleep, not eating right, all those things can impact someone's mental health. And then I think that when I think of self-care, I tell students, like, I don't know, it's just, I feel like self-care is just such a buzzword, right? Because everyone has their own definition of what it is. Like, what is self-care? Like for you, I think, sitting with a student, we kind of talk about what it looks like for them to be like feel the way that they want to feel or be where they want to be. So thinking of the resources that they have in order to implement self-care. And let's say self-care does include having certain appointments or doing certain physical things, and just having that kind of scheduled into their kind of day, so it doesn't seem like something that um that's not prioritized. Like I always tell them, like, your self-care is to be selfish. Like it's to do what you want to do for yourself in order to do what you need to do for your family or anybody else, your schoolwork. Like if you don't pour into yourself, you can't pour into other things. So just making sure to schedule it and be realistic with yourself on what self-care means to you and looks like for you.
And that's so wonderful because it's about like building habits, because you're right, self-care, the definition of self-care as a student may look very, very different once these students graduate and move on to their careers and they're in their field. Like that may look completely different, but having the habit of prioritizing self-care already sets them apart and puts them in a better
Right.
position.
I think you make such a great point. Sometimes I have students that come in who have coping skills or things they did for self-care in pre-med, and now they're in medical school and they're wondering why it's not working. Well, you're in a different kind of journey, right? It's
Yeah.
way more stressful. There's so much more stresses and things that are happening. And not only you're in medical school, you got a wife and kids, like you have responsibilities outside of school. So it's like, okay, we need to adjust what your self-care looks like in this journey. And it might look different when you go into clerkships, when you go into residency. And we just continuously just updating those things to make sure that it fits the journey that you're in at that moment.
Absolutely. And paying back student loans and all that, like you said, all that financial stress that can absolutely impact mental health. Well, thank you so much, Dr. Barrett, for sharing that.
Yeah, I just wanted to share that I do feel like healthcare, mental health care and self-care has evolved and changed so much, especially in the last 10 years. I'd even say probably, I think you guys would agree, since the pandemic.
Mm.
It became so paramount that people needed counseling, dealing with grief, dealing with loss of loved ones, isolation, abandonment, loneliness, sickness, and what their long-term future life would look like. And I remember how I used to look at I know it's evolved for me because I used to look at, now don't judge me, but I used to think of mental health care as, someone that had problems. Who needs mental health care is someone that has problems, or someone has, issues, or someone that needs help. And how it's evolved for me in my life is that we all have problems. We all have issues. We probably all need a therapist, so that's how it's evolved, for me. And even with self-care, I remember used to be like, we thought of self-care as getting a massage maybe every couple of months, doing a fast or a cleanse, you know what I mean? Every, once a year or something, or making sure that you take your vacation once a year or something like that. And now self-care has become so essential to life. Like it's like breathing, it's like sleeping, like eating. It's necessary in order for us to be successful and to prevent, ourselves from crashing and burning, from, compassion fatigue and burnout, being students, being, carrying all these titles and roles that so many of us do. Self-care is like essential, and having someone and having those sacred spaces, as we're talking about today, is so paramount, I think, to all of us, students and all of us are in need. So I really do believe it has evolved so much, and it's definitely evolved in my mind, or how I see mental health and self-care.
Yeah, I mean, especially within the healthcare with high burnout rates and everything too. It is absolutely essential. So thank you for sharing that.
As a graduate student, when I was a graduate student, I'm not currently a graduate student now, but I found myself seeking out psychotherapy services at the university I was at, which was a really very helpful for me at the time because graduate school, it was a double master's program, which was very demanding. And I know medical school has to be very demanding, but I think it made me a better psychotherapist. And not just for psychotherapists. I think for any helping field, I think it's beneficial to have experience with, I guess, working with the psychotherapist, or not is not required, but just saying I feel like it made me a better helper. And so I think anybody in a helping field, could benefit from psychotherapy services because, helping other people is demanding and it can be draining if you if I hadn't really dealt with my own stuff and learned about boundaries and learned about, what's mine and what's yours. Um, and so I think that that experience made me a better helper. Um, and I would say that, people, well, the other thing I would add, that has changed, which has already been talked about, is that because of COVID, we all learned that we can do psychotherapy online. And so it's more convenient now. You don't have to be in the same room as a psychotherapist or helper. Um, whether, regardless of, whether it's a medical professional or mental health professional, so it provides more flexibility. So you don't have to drive across town, make an appointment, be there on time. And so, that's definitely something that has changed. And here at APLA Health, because of COVID, a lot of our psychotherapy services went online. And since we are here on campus, we are available to students. So that's another option for students who might find themselves in need of psychotherapy services.
Yeah, and accessibility has changed over time. And, obviously, unfortunately, the pandemic occurred, but it did open up the worlds of telehealth. And that's such an important, thing that got rid of a barrier for a lot of individuals to seek care. And even what you mentioned before, too, it's hard to believe that there was a time where therapy and case management didn't exist on our campuses and at schools and in workplaces. So it definitely has evolved over time, but successful. Would you like to answer?
Well, yeah, I just, of course, love everything that everybody mentioned, but I do want to add what I have noticed. A lot of people now don't feel guilty about
Mm,
self-care because I know personally that was something that I battled, having all these different roles and all these different responsibilities, and you feel like you have to do this, that, and you have to make sure that everything is on point and you put yourself last, so over time, I learned that it's important and essential that you do make time for self-care. If that's putting your phone on do not disturb, if
mm.
not scrolling on social media, taking the whole apps off your phone, muting certain people, whatever you got to do to make sure you're protecting your peace, exercising, eating right. People now feel like, listen, this is my self-care. These are my boundaries, and this is what I'm doing for me. You like it? Okay. You don't? Okay. So I think that that's very important, that people are now owning self-care.
And I love how you touched on guilt, and it's actually a perfect segue into the next question as we talk about stigmas. And yes, with all the evolution and improving conversations and just advocacy around mental health care, like there still exists stigmas around seeking mental health care and engaging in self-care, just across all different types of communities, whether that's community color or sexual orientation, gender identity. So how can we actively work to eliminate this stigma?
I think we can help to eliminate it by having these types of forums, by talking about it and letting people know that, this is an important resource, and it's available to students, especially students or community wide. Um, as a man, I also have to say that, hey, I've done psychotherapy. I mean, I've been a patient of a psychotherapist, and it's okay. And, men, um, if it's okay for men to be under the care of a mental health professional. It's okay. We don't have to be strong, and men do cry. It's okay to
Mhm.
cry. And we just have to keep talking about those things and letting people know that it's okay. It's something that's available. And if there's a need, by all means, take advantage of it.
Yep. It all starts with a conversation.
I think also to just normalize it, like, much like David, like I see a therapist now, like compassion fatigue is real, like dealing with people and listening to other individuals' struggles. It can be hard on you, right? And like, what if you're dealing with your own struggles? Like,
Mm,
I think prioritizing my own mental health has been a priority for me in order to be, uh effective psychologist. I think being transparent with the people that like the students that I work with and the patients that I work with, um, and letting them know, like, hey, it's okay to struggle. Like I've struggled. I think sharing things that you've been through depending on the context of the session, and it's not all about like the helper, right? But I think also normalizing how they're feeling and humanizing it, like people struggle, people go through things, and it's okay. And being here in this space, at least in this session, is a good start. Yeah, like everyone should see a therapist even if you're not struggling. It's okay just to talk and have someone to check in that's not biased and can be objective.
yeah. And the imagery that just pops up in my mind, and as Sarah also said too, helpers need help too. I think of like, pouring a pitcher into a glass, and that's what we do in the helping, in the helping sphere. But it's like eventually that pitcher runs dry. We need people to pour into us as well. So thank you for sharing that, Dr. Barrett. Sean, were you going to say something? Oops, sorry. Yeah, there.
One thing I was going to say, I'm agreeing with Dr. Barrett, normalizing, and we are normalizing by having these conversations, these round tables, still continuing to have healthcare conferences, mental health conferences, in person and virtually. I was a part of last year a symposium on perinatal medicine, talking about postpartum depression called From Pain to Power. And it was amazing because women came out and they actually shared their stories. It was so impactful. There were men and women in the room, and everybody was, had tears in their eyes because it just hit home how big, impactful, how this impacts everyone, but also stigmatizing the language we use around mental health. If we get away from using words like weird and whack job and crazy
Crazy.
and those type of things, terminology, when someone doesn't quite understand or have the capacity or the experience to understand the challenges that some people are having. And sometimes we irresponsibly use, these terms that are not healing at all. And they actually promote more divide and separation and more stigma. So I think that's really important for us to, destigmatize by changing our language around mental health, which I think we're coming to that, and we're doing a good job with that. We just want to continue to do that. And also, I think utilizing, because we know, especially with young people and students and all walks of life, we tend to have our favorite actors or our artists and musicians and those type of people, and many of them struggle with mental health issues. We know Taraji P. Henson has been very vocal. Kiki Palmer has been very vocal. Kid Cudi has been very vocal about their struggles and mental health and the work that they do in the community. But I think utilizing celebrities and athletes and those that are willing to be bold enough to share their story, to be a part and be speakers more, in these roundtables and in these community virtual spaces and conferences would help also, especially with younger people and students as well.
Yeah, I love how you touched on both the individual experience by maybe just, changing our language and seeing how that affects ourselves, but also expanding to the societal level in a way of being able to change those systems in ways that this is a very collective experience that all of us, if I can say, have. So I think that's very important that you touched on that. So thank you. All right. Successful. Did you want to add anything, or are we ready for the next question?
Yeah, I think everybody answered, normalize it, having these conversations. We're doing it.
Yep, exactly. And yeah, I think it's definitely very easy for us to feel powerless in extremely stressful situations. So just by starting at eliminating stigmas with these techniques that we may have about our own mental health seems like just a great way, a good place to start. So a common theme among our students here at CDU is the pressure to always feel productive, and being told to rest is often met with a lot of feelings of guilt, like a few of you have mentioned too. How do you suggest students prioritize their self-care? And we have touched on this a little bit, but if anybody would like to expand on that.
Oh, I can go. So with self-care, like we mentioned before, finding what you're interested in. So I believe that's what self-care starts with, whatever makes you happy, what brings you joy, what brings you peace, so finding what that may be and then honing into it, making time for it, making sure that it's scheduled in your day or your week, because it could definitely get lost with everything that you have going on. But if you make whatever hobby that is a priority, if that's journaling, reading, going for a walk, disconnecting from your phone, making this time set just for homework. I got really good at that, making sure like this is the time that this is work time. After that, I'm doing whatever I want to do. So just making sure that you prioritize yourself and even learning more about yourself. It's maybe some things that you don't even know that you like or that you're into, having those relationships with different people, just making sure that you are spending quality time with yourself also. That's super important. So yeah.
Sounds like a lot of boundary setting and also just having fun. Like life should, we should be able to tap into creative sides of us. I'm even starting to read a little more, and because I'm reading a little more, it's, introducing all these other themes that I had never explored before. So very, very great points.
And I think also for students practicing, one tool that I think I found to be most helpful, really helpful, is practicing mindfulness. Just allowing causing students to center themselves and just to focus on themselves and being very present in the moment. Not for anyone else, but for themselves, and to be able to find that, as Successful said, find that work-life balance, letting them encouraging them to be accountable for their own self-care and recognizing the power of their no. And knowing that it's okay to say no. It's okay to say no, not right now, because a lot of us we do carry around guilt on having to, show up for everybody and do everything, on point and be perfect and excel at the top of be on the top of our game with everything. But as we've all shared, we can't pour from an empty cup.
Mhm.
And so how successful at the end of the day are we really going to be, and how much can we really give to others if we don't have anything for ourselves? So the time management and finding that work-life balance and the power of their no, and just tapping into those different techniques that allow them to just have some downtime, with mindfulness or meditation or yoga or whatever your thing is, journaling, art therapy, music therapy, anything that promotes those creative expressions of who we are and who we need to be for ourselves, so that we can go out and be the best that we can be for everybody else. I think is so important to put to have students to know that they first are the most important.
Absolutely. And I'm really glad you brought up mindfulness too, because I think as students, there's so much going through our head, whether it's life, work, school, relationships, financial struggles. And even sometimes it's hard to just like sit and meditate. But, like you mentioned, there's guided meditation, there's yoga here at Shaw. We provide student-led yoga a couple times a month. And just a really good way of just being able to just participate in that mindfulness and that meditation. I actually tried it last week and it was very helpful. It's right in the middle of the day too, so you can kind of just get that midday fix that you need and then go on with the rest of your day. So thank you for bringing that up. Would anybody else like to share? Awesome. Wonderful. Well, I am, I'm sure our students are super appreciative of these techniques that we are sharing today on how to prioritize self-care, especially just with, again, all the things that students do go through. So what are some ways mental health agencies or organizations can help to build a safe space for clients and people of color? What are some ways higher education and other universities can just continue to build these spaces for these students?
Well, I would say having more peer support programs
Mm,
learned is super essential. Even creating a space for people who are aspiring to be in the mental health field. That's what we do at NPN. I know you see my name on here a couple of times, but these are my interns. Some of them changed their names, but I have interns and volunteers. So if they're interested in becoming a part of the mental health field, they have an internship here where they can come to different events like this, help us get ready for panel discussions, do research, so that way we can put psychoeducation on the web and things like that. We also have interns that go to our different events and they're able to accumulate hours when they're in their graduate school programs. So just being able to be in the fields. I remember when I was getting my master's and applying to the program, they was like, well, what, experience do you have? I didn't have any experience. I was in
mhm.
undergrad. Like, how do you even get experience? So just volunteering, I was able to volunteer at the mental health court in DC. I just researched and looked for it, because my degree is in clinical forensic psychology. So,
Mm.
just look for a place where you're able to volunteer and help in the mental health field. So I just think joining organizations and organizations giving, students the opportunity to learn more about the mental health field will help.
Absolutely. Exposure is truly everything. And by, making these things accessible and available can really make all the difference. So thank you.
I think also, what you asked about, what universities and agencies can do beside, I think at the university level, which I know Drew has and a lot of universities do, and we encourage, as we talked about, those going into mental health field or into even any helps, as John said, any help field or healthcare provider, cultural diversity training, cultural sensitivity training for those to be able to, those that will encounter we all encounter biases, we all encounter racism, but to understand where that comes from and to also learn about not only ourselves, but learn about other races of people that we will be coming in contact with, I think is really key to helping to create safe spaces. Because I feel the more that we learn about one another, the more commonality we have, then the safer the space becomes. You don't feel like a misfit,
Mm-hmm.
or having to get in where you fit in. It's like, this is where I belong type of thing, right? And so I think that would be really, really important. And then agencies that are providing for a safe space. We've talked about there's so many, there's apps, we have the online programs. There's so many opportunities and such great organizations and nonprofits that are out there, such as Successful's organization, and so many organizations out there, which I love to see for men and for women, which is awesome. But also offering them at a convenient time, like weekends, evening, maybe even early morning appointments, making it even more accessible. And then we know that there's funds, and there's some organizations that have scholarships actually, or sliding scale for those that are financially challenged. I won't say broke, I call it financially challenged. But so that makes it be more accessible, for the students and for individuals to access that care. Also, conflict resolution training is really, really important. Because how can we be safe in a space if we don't know how to communicate with one another? We don't know how to get our point across and express that in an effective way. So I think that those are actually trainings that agencies and universities can offer that would help to bridge that gap as well.
And it's just so wonderful how you're bringing up all the different levels of influence on mental health care. Because yes, a lot of it does start with us and individual change, but also the system needs to change. And whether it's, like you said, making it more available with certain times of the day to be able to help improve these mental health outcomes for students and people of color, people that are pregnant, and in whatever situation that they are. So thank you for bringing that up. Okay, so we are coming towards the end of the panel today, so we'll go ahead and end on this last question. So kind of talking about the systems and agencies that do exist or ideally could exist if there were a system that effectively supported the mental health of Black communities. What essential features and functions would it have? And do you know of any organizations or agencies that already exist that do this work to improve mental health outcomes?
Okay, well, I'll start with the one of the committees or people that I work with. They're called Jail Guitar Doors. I spoke about them briefly already. They definitely help youth who are interested in learning more about mental health. And we are the mental health nonprofit that provides them the therapist. So just go on our Instagram and you can find out when the events are held, but we have it every Friday, but they also have different events. Also Hiking for Black Men. I know that's a nonprofit that also, again, hobbies, self-care, things that you're interested in. The Giant's Den, that's also a Black males mental health organization as well. And then MPN, the Minority Psychology Network.
Mm-hmm.
Tap in.
Yep. Got to make your plug. It's important. You are the change. So thank you for sharing those. I'm definitely writing down notes so I can share with everybody after as well too. Anybody else would like to share on kind of their ideal? Go ahead, Sean.
Well, I'll definitely have to put in my plug too. Claris Health, we're a nonprofit organization that provides women's health care for pregnant women and birthing people, as well as males. We also do, sexual transmitted infection screenings and counseling. We have counselors here. We have interns. We have psychologists, and our therapists are wonderful. We provide services, we do resources, parenting, fatherhood programs, birthing boot camps, and across all of those different services that we have at Claris Health, we have counseling is woven into every aspect of everything that we do, which is wonderful, as well as of our mobile clinic that we go into the city and we do street medicine, which I absolutely love, taking the medicine to the street. And there we also provide patient advocacy and counseling, and they can get referrals for our resources. And we do not charge if they do not have insurance. Our services with our therapists are waived. And so we are doing, I believe, a phenomenal job in the community. And then some of the other agencies that we worked with is Mental Health Now, which was in charge of that program I told you about last year, From Pain to Power. Mental Health Now does a lot of perinatal, mental health, activities and events. I love Therapy for Black Girls. I don't know if you guys have heard of that, but Therapy for Black Girls is awesome. They have a podcast, they have events, they have roundtables, conferences, books. I mean, they're great. Therapy for Black Girls. Black Men Heal is another great community online organization. Therapy in Color, Dr. Ashley Bryant, she founded that, and her foundation is Holding Space Foundation. They do a lot. There's just so many, and so many blogs and apps, and Black Therapists Rock has a Facebook group, and it's primarily for therapists coming together and having continuing education trainings and conferences. And so, and then one app I wanted to mention is the Liberate Meditation app. That's an app that someone can download, can do meditation. And then, of course, YouTube guided imagery is free to anybody. And they just Google what they want guided imagery for. And my grown daughters, while they were in graduate school, are the ones that told me about that. And I've been doing that guided imagery with Jason Stevenson on YouTube ever since. So those are the ones, my go-tos.
Awesome. Thank you so much. So many. I've written down so many of these resources that exist because they don't want us to see us succeed. But what I'm hearing is we're seeing the barriers and conquering them as best as we can. So thank you for sharing those. And David, Dr. Barrett, any to share?
I would just add that that APLA has a team of mental health professionals that are available either in person or telehealth. And we have African American psychotherapists on board. And our staff is diverse based on gender, sexual orientation, race, ethnicity, age. And so I just want to mention that to let folks know that we are available to students, and we are an LGBTQ affirming organization. Another organization I want to mention that's close by is AMAAD, AMAAD.org. They provide mental health services, and they're only about a few blocks here from campus. So that's another resource.
And thank you for sharing ones that are very close by. In fact, even just attached here on campus as well too for our students. And I'm very familiar with AMAAD too. So thank you for that, for sharing that one too. And thank you for those sharing in the chat too, some organizations and websites. That's super helpful. Thank you. Okay, well, if there are no other questions, that concludes this year's Black History Month Mental Health Panel. I personally want to say thank you so much to our panelists for, again, your insightful and thoughtful responses today. I think I can speak for all of us on how important it is to hear about your expert knowledge and just personal experiences of mental health care, self-care, and just building on the strengths that exist within the Black community. Thank you to our participants for tuning in and listening on the conversation today. If any of you do come up with any follow-up questions or comments, please feel free to reach out to Shaw. You can find our contact information here on this slide. Also, feel free to follow us on Instagram to hear about just other events and resources that we provide. Also, this panel was recorded, and we will be uploading it to CDU's YouTube page under Shaw's webinars playlist. So if you would like to rewatch it, or even like to share this presentation, you can find it there. So again, thank you all for joining us today. Happy Black History Month, and have a wonderful day. Goodbye.
Thank you. Bye.
Thank you.
Nice meeting all
Bye.
you guys.
Nice meeting you all. Bye.
Work.